American women are waiting longer to have kids. Fresh new CDC data shows the average age of women giving birth in the U.S. is now 29.6 years old. That's up from 28.7 back in 2016. And the average age of first-time moms has jumped to 27.5. Dr. Jessica Shepard is the chief medical officer at HERS and a board-certified gynecologist to help us understand why this is. Good morning to you, Dr. Shepard. So why are women waiting just slightly longer to have kids? This trend seems to be increasing over time.
Yeah, these reports are very helpful. And when they were looking at these trends, it even showed it across all ethnicity and races that they had that increase, just as you were explaining. And there's a lot that goes into these increases in age, is that women are delaying motherhood. A lot has to do with choice based on education or financial ability to do that. But there's also other things such as legislation in coverage of contraception. And also, the variety of contraception that's available for women today has improved. And so it allows women to have better coverage. And then when we also look at social media is a great tool for people to see what's going on broad scope in their neighborhood, but also in the country and globally. And so what you will see is on social media, it does show trending of what people are doing. So this information is being spread in a way that's not just in reports that we see behind the scenes and what that number looks like. And I think just when we look at also teenage pregnancy, those are actually decreasing as well. And that to me is really a public health success because we're allowing women to make that choice of when they would like to embark on motherhood and giving them the option to do that based on their decisions.
Yeah, it sounds like increased freedom. I mean, the things that you've laid out sound like positives, that women have more choices, more time. But what are some of the risks for delaying pregnancy?
That's a great question because, from the medical perspective as an OBGYN, we do still have to make sure that women understand with delaying motherhood and being older, like we said, from 28 to 29, when we start to look at the age of 35, that's when we start to look at the natural ability to spontaneously get pregnant. And that does start to decline after that age. So again, there's education that needs to be on that end so women are very sure of the decisions that they're making in their delaying of motherhood, that they understand the implications that come with health and also carrying the pregnancy after a certain age, that there's going to be some increase in medical attention that needs to be done as well.
Yeah, fascinating study. We encourage
Great.
folks to look into it. Dr. Shepard, thanks for joining us this morning from Dallas.
You.